We are a global humanitarian organization dedicated to saving lives and relieving suffering. Established in 1984 by volunteer doctors and nurses, we are a nonprofit with no political or religious affiliation, and now have more than 7,000 staff members around the world, more than 90% of whom are local. Our mission is to improve the quality of life through health interventions and related activities that strengthen underserved communities worldwide. With the flexibility to respond rapidly to emergencies, we offer medical services and training to people at the highest risk, always working to strengthen local healthcare systems and promote self-reliance.
International Medical Corps is an influential nonprofit because it not only provides disaster relief, but creates a foundation for the communities through training. Medical teams respond to all disasters, despite the distance or risk involved. Within the first 72 hours, International Medical Corps arrives to deliver medical care and other critical relief. However, this nonprofit does not stop there. Training is at the heart of their mission and equips the local communities and governments to handle future emergencies, ultimately building self-reliance. In the midst of the COVID-19 pandemic, International Medical Corps is working diligently with local and national health organizations to provide knowledge, training, equipment, and medical services. The organization has deployed medical teams in the United States, Asia, Europe, the Middle East, Latin America, and Africa. A multi-step approach has been implemented to effectively help countries during this unprecedented time.
Not only is the International Medical Corps unique, but they're better. They focus on training and building self-reliant communities. They're reliable, transparent, and budget wisely. In 2014, the Democratic Republic of the Congo experienced their first and biggest outbreak of Ebola. The International Medical Corps has been with them since then. They've built a team of 1,500 dedicated volunteers treating 460 Ebola-positive patients in 5 treatment centers and building 95 screening centers throughout.
Yemen is a war-torn country, plagued by famine and malnutrition. IMC is helping by supporting treatment sites for malnutrition in the area and creating targeted supplementary feeding programs. In 2018, IMC was able to help over 25,000 people in the area, some with extreme health complications.
Since 2011, when it began, the Syrian war has resulted in the suffering of millions of innocent people. 5.5 million refugees have fled to other countries, leading to the largest displacement crisis ever seen. Fortunately, International Medical Corps acted quickly and has been on the front lines since 2012. The nonprofit is supplying medical care and psychological support to the families desperately in need.
The International Medical Corps is a financially stable nonprofit that donors can trust with their money. For the past 3 years, they've had large revenue of around $130 million. Of that yearly revenue, they usually put away 10 to 15% for rainy days and never exceed their budget by more than 2%. 87 cents of every dollar donated to International Medical Corps goes directly to the people that you are trying to help, with only 12 cents of every dollar being consumed by overhead.
We are recommending a gift of $15,000, which would be less than 1% of IMC's annual budget. We believe the gift should be unrestricted, as IMC works in over 30 countries, and it would be cumbersome to their efforts to limit our gift.
35 years ago, we set out with a simple mission: save lives and train healthcare workers in the world's most underserved places. Every day since, we have done just that. Through wars, disasters, and famines. Through loss, devastation, and disease.